Welcome to the new CPmate software for Clinical Pilates program and patient note-taking experience. We have two processes for using the program. The first is just doing a program set up from a set of templates. If you've decided the patient, or we know the patient is a right extension bias, for example, we can click on right extension bias, add a new patient, name them test. We can remove that from it, and we'll then have a template of exercises which we could print up as a treatment for the patient, having our exercises there, space for treatment notes, space below for recording tests, and of course our bias for the program at this stage allowed. This can be printed out onto paper notes. This can be also taken into digital programs with pen as needed. At the same time, if we decide we don't want some of these exercises, we can take them away. We can also move exercises around and place them where we need. If we want to add extra exercises to that, the select button will give me more possibilities. Again, all matching the same bias. We can then go to view. There are the exercises we've selected. We can save these or just take them straight to print. In this case, I'll print a program for the patient, as we'd be doing down the track once they're into the more maintenance phase, and we have a program with room there for notes, which would follow on from a treatment cycle with the bias selected as below. We have alignment in here so we can review the patient. We can also review the bias icon if we want to add stage 2 exercises. That'll give us a wider range of exercises, and of course the unit B will give a greater repertoire of exercises as needed. We can also then look at more lateral exercises if needed and include both sides as the bias progresses and the patient also progresses. They can be hidden and they can be hidden. The other process, of course, is doing a patient as a new patient. So from a subjective standpoint, we need, of course, patient details for this test and park that away. For collecting data, we can start with, say for instance, someone has right low back pain and right LBP, 5-year history after fall onto buttocks. We then have in the part 2 here including glute pain. Second problem, we can have other issues. They may have had a radiculopathy in a right calf, leg pain and right hip pain. So we have a past history, still ongoing problems with hamstring, etc. Looking further, allowing also past history could now be resolved, and these can be marked in green. So the colour coding allows us to say here's the primary presenting problem, other coexisting problems, and of course, previous shoulder surgery, etc. Put that in here. Right shoulder surgery as needed. Now, importantly, of course, the AGs for our primary problem. You may have sitting, bending, getting out of car, etc. Things they find easier, walking, swimming, lying prone again, will all fit a specific pattern of behaviour. Past treatments can be typed in there. Overnight pain, sore, out of bed, sleeps, fetal right side. Any medications, now they can be collected either as a photo taken from the iPad or typed in. Take a photo of the medication bottles if need be. Same with radiology. You can just report on the MRI as they tell you. You can also take a photo or import from a file into there. Same with any reports they may have. Photograph, scanned in as a file, parked. Other comments, special questions, past history, cancer, now resolved. What are their plans and goals? Return to marathon running. Their funding, occupation, what do they do for work, and of course, funding in this case, looking for, do they have a specific fund? Are they self-insured, public insurance, or they may be insured through a private health insurer? Some patients with autonomic problems, of course, asking the usual bowel and bladder questions in here. Do we have bladder problems? Do we have bowel problems? But also coexisting cardiac, gut, nausea, dizziness, chest issues. These can all be included. If there are no problems, we ask the questions, they're left as a 0. If they do have problems, they can be 0 to 9 as to how great a problem they are, and this can be kept an eye on with ongoing measures. So, final comments, anything further there to be added can be included. That can all then be saved. Getting back, our patient details. Got it. And we save the patient as there. Into our objective, we can make our notes clinically here as to what we may make our basic observations. Stands with contralateral list to right, etc. Any observations and notes as you would take with patients. We can also go into function tests. Now, looking at this, we can include pain, to click the VAS scale, or remove that. The default for lower limb being squat, rise and hop. We can add in from there single leg balance. If they can't hop, have a range of tests there. We can also have upper limb tests, which is just looking at function, and they could be used for an upper limb patient. If you wish to add other tests in of your own, you can do that, give it a name, and then also how it's going to be, what name it's going to be called and used in the tests. We'll get rid of that for now. So if we find a right side patient, the pre-intervention, they decide that they're a 4, and still a 4 out of 5. All of these are N out of 5, maybe a 2. After testing, they're 3. And of course, 2. After testing, they're 3. If the right side's a problem, you might find the squat's very poor, heel raise is very poor, single leg balance 1.5, also very poor. We have a scale showing considerable lower limb function deficit, left, right versus left in the pre, in the post of course. Then we find they've improved measurably. We can use a point there, and we have a percentage improvement post-intervention. For range of motion tests, straight leg raise is standard. Others can be included: knee extension, knee flexion, hip flexion, fade ear, Faber, range of motion, upper limb, cervical. They can also be included if needed, and those numbers could be taken alphanumerically for recording. Getting down further, the end of the side, if this person's a right side, doesn't like flexion, prefers extension, select their bias or just use a template, hide that, and we have our template program. You just want to keep it extremely simple, just give them home program, take out these, and there we have it, saving at that point. We want to then print that program. We want the full process. We have our colour coding chart, our notes, history, AGs, as the usual. We've at least asked the bowel, bladder, etc. questions with autonomic disturbance. We can include the pain, exclude, have our numbers, and then have our program, so that can be printed off and saved in an appropriate file. We will be adding to this program further using video inclusion, and if you wish to have a trial of this, we can for 30 days, after which point we can be using it, we can be using it on an ongoing basis. Thank you for looking at the CPmate program. We look forward to having you on board.